incentives such as attendance at meetings overseas. It is best if these pharmaceutical companies deal with medical associations and professional bodies rather than with individuals when awarding overseas trips to doctors. Fees charged by doctors should be reasonable, and in the case of surgical operations, it would be prudent if the surgeon discusses the fee with the patient and his immediate family prior to surgery. There is no need for doctors to chase after money, as nearly all in the medical profession are financially relatively stable. Good doctors make the care of their patients their first concern. They are competent, keep their knowledge and skills up to date, establish and maintain good relationships with patients and colleagues. They are honest and trustworthy and act at all times with integrity. Continued professional development, or CPD, in the form of continued learning and assessment, such as regular peer review, is recommended. You obviously must recognize the limits of your professional competence and seek the help of colleagues for the care and well-being of your patients. The rights of patients to be fully involved in decisions about their care must be respected. In Sri Lanka up to now, euthanasia or mercy killing, whether active, assisted or passive, is illegal in Sri Lanka, and this includes withdrawal of life support or notices stating "do not resuscitate." That is illegal. All doctors should realize that the primary objective of the medical profession is to render service to humanity. Reward or financial gain is a subordinate consideration. In carrying out this noble service, one should conduct oneself with propriety, remaining modest, sober, kind and patient at all times. Doctors should merit the confidence of patients in their care, rendering to each a full measure of service and devotion in keeping with the dignity to which every human being is entitled. It is essential that doctors have a nurse or chaperone, especially when examining patients of the opposite sex. Following this simple principle will avoid embarrassment to both the doctor and the patient. Treating female patients with the same care and dignity as treating one's mother would prevent many an unnecessary problem. The practitioner should use methods of healing founded on a scientific basis. The honored ideals of the medical profession imply that the responsibilities of the doctor extend not only to individuals but also to society itself. Modern scientific medicine would recall Sir William Harvey, the first to describe the circulation of blood. A good clinician was in the past often remembered as a happy blend of the art of Sydenham and the science of Harvey. Sir William Osler was a physician of great repute and had been a professor of medicine at 4 universities, at McGill University in Canada, University of Pennsylvania, Johns Hopkins University in Baltimore, Maryland, and the University of Oxford. He has been described as a role model for clinicians, and I would recommend you read his book, Equanimitas. Well, this is an exciting time to commence the practice of medicine, with new frontiers such as the genetic code and gene therapy, stem cell harvesting, and the limitless possibilities of stem cell therapy. Life is so short, but the craft is so long to learn. So said Hippocrates nearly 2,500 years ago. I conclude my address by reading to you a poem, If, written by a former professor of medicine and a former teacher of mine from a bygone era. At his feet we learnt bedside clinical medicine at a time when sophisticated laboratory and radiological investigations and imaging techniques were non-existent. This teacher inspired many generations of doctors to show concern and compassion to doctors irrespective of their financial status. Now this is the poem If by Professor K. Rajasurya with apologies to Rudyard Kipling. If you can bear in mind that you are dealing with human life and not with cases prey, if you can treat them without discriminating whether they are labeled pauper or to pay, if you can rush with equal alacrity to see a case that needs attention stat, if it's no matter, there's no bakshi in it, yet if offered, you can refuse it flat. If you can smile and cheer up the ailing, or by a touch relieve the suffering pain, if you can by a word console the dying who will never taste this earth's torture again, if you can force your heart and nerve and sinew to work overtime for those who need your skill, if all that counts is just the joy you're serving, and it matters not what happens to the bill. If you can wait but not be tired of waiting for the fame that one day perhaps you'll earn, cheap notoriety, the wild disdaining, no rush to print because there's much more to learn. If you can leave the trick of advertisement to those who made it a crooked art, knowing it's but a quack's once accomplishment of honest men, it never forms a part. If you can talk with touts and keep your virtue, and treat big bugs nor with the poor loose touch, if neither wealth nor fame can yet corrupt you, and all beings count with you, but none too much. If you can fill the unforgiving minute with 60 seconds of work well done, you'll then have reached a noble profession summit, and what's more, you'll die content, my son. Thank you very much, ladies and gentlemen.